Identity is important. Identity is important for everyone, and it's particularly important for me. Becoming a woman surgeon was more difficult for me than many people in this room because I was born a boy. Identity can be defined as who or what we are, but importantly, it's also the way that society sees us. When I was born, I was seen as a boy. Anatomically, I was male. Psychologists tell us that identity is formed in infancy. I don't remember anything about my infancy, but I have a clear recollection of my early childhood. As a 5 or 6 year old, I recall wishing that I had been born a girl. In fact, going to bed at night and praying that I would wake up to find out that I changed into one. But those prayers and wishes were never answered. In grade school, my playmates and closest friends were always girls. Later, social pressure and the onset of puberty changed some of those friendships, although many continued into high school, where I hung out with a 10-girl posse. During high school, my focus was a million miles away from surgery. I was artsy, bookish, and creative. I concentrated on art, photography, theater, and journalism. I began college at the University of Wisconsin-Madison as an art major, with more than 24 hours a week of studio classes. I was really good at art, receiving straight A's in all my classes. What about my gender identity? That conflict was still there, but now that I was at a university, there were medical libraries with all kinds of information. So I researched treatment of transsexual individuals, which was the term back at that time. It didn't look promising. People like myself were portrayed as very disturbed individuals. There were some experimental surgical procedures that were described, nothing about medical or psychologic management. So in 1973, it was apparent that there really were not any good options. While I was restless and frustrated in the early 70s, so was the country and the world. I aspired to help people and make the world a better place. And I questioned whether art was the best way for me to accomplish this. One of my friends had switched from a math physics major to pre-med. And in our discussions, the ideal of a selfless profession that helped people was a really powerful draw. In my case, it was also a very effective distraction that let me focus on others and not on myself. So I switched. Never mind that I hadn't taken any science or math classes since sophomore year of high school. I could do this. I had a purpose and a goal. I threw myself into my classes, worked in a research lab, and volunteered in the emergency department. In medical school, surgery was particularly attractive because of the way that it melded form and function. Surgery was also a demanding taskmaster. I matched into a program that emphasized training future surgical leaders and expected the residents to obtain a PhD during their training. By the end of residency, I'd written a funded R01 grant for my mentor and published 23 peer-reviewed papers. I was a surgeon. Women are often told that we can't have it all. We have to focus on the most important things. And surgery was a really important part of my identity. I suppressed and tried to ignore my gender conflict. What choice did I have? And instead I focused on my career. And my career was in academic surgery. And in that role, I was promoted to professor, first at the University of Minnesota, and then at Northwestern and UCSF here in San Francisco. I'd held numerous leadership positions, and I rose to the upper echelons of surgery. But by the early 2000s, I could no longer ignore my gender dysphoria. I sought professional help and was able to finally admit to myself that I was a transgender woman. Now what? Medical therapy with testosterone blockers and estrogen helped a lot. I felt a lot better. The medication also resulted in some significant physical changes, but while I was very okay with those, others were not. including my wife. She agreed that we could remain married as long as my gender identity stayed a secret. But after a few years, from both of our sides, more than 60 people came to know that closely held secret. And after 36 years of marriage, she decided that she'd had enough. She filed for divorce, which eliminated my last excuse to not transition. In December of 2013, I came out and I officially became Michaela on January 2nd of 2014. A year later, I had gender confirmation surgery, and I was finally the woman that I always wanted to be. Now that should have been my happy ending, but it wasn't. My decision to transition necessitated my retirement from the University of California, San Francisco under a settlement. I no longer had a job, and I was unable to get hired by anyone for more than 3 years. On the other hand, the woman part was wonderful. Other women were very welcoming, socially and professionally. My outness created fantastic new opportunities, such as being invited to be a member of the American Surgical Association's Equity, Diversity, and Inclusion Task Force, becoming a founding and steering committee member of Time's Up Healthcare, and joining the board of the AWS Foundation. Best of all, my ex and I remained best friends. Eventually, I obtained a part-time, non-clinical job to oversee trauma research at a level 1 trauma center in Minneapolis. But I still identified as a surgeon. I guess that I wanted it all. My employer was willing to create a non-paid re-entry pathway that entailed more than 6 months of supervised surgery, trauma, and ICU care. And finally, this summer, shortly after my 65th birthday, and at a time when many of my colleagues were retiring, I was granted surgical privileges and returned to clinical practice. I am now back on call, back in the ICU, and back in the operating room. I am working as a surgeon, and I am a woman. Identity is important. I am a woman surgeon. Thank you.